Morning.
Nice to see everyone here bright and early. And we're really excited about the day, so welcome. You know, as a parent, our worst nightmare is having someone tell us that our child has died. And when that is compounded by the fact that it didn't have to happen, it fuels a fire to assure that no one else hears those words. And that's exactly what happened with Wanda Irving, our next speaker. And I remember the first time I heard her story, and it was many years ago. I think her little granddaughter might have been not quite two. And, you know, I made a personal commitment that whenever I spoke about maternal mortality, that I would raise that story because we need to honor the names of people who have been lost and learn from that so that, again, it doesn't happen again. And Miss Irving has taken that pain to move her daughter's legacy toward that end. And I want to tell you a little bit about her before we hear from her. Early in her career, Miss Irving developed a passion and a track record in leading community betterment and social change initiatives. For nearly 3 decades, she worked in the federal government, city government, faith-based organizations, and the nonprofit arena where she focused energies on impacting, positively impacting communities and individuals by helping organizations to develop meaningful partnerships through shared visions that achieve innovative solutions to complex community issues. In January 2017, her daughter, Shalon Irving, died from childbirth-related complications 3 weeks after the birth of her daughter, Soleil. Devastated by her daughter's untimely and completely preventable death, Ms. Irving has become a staunch advocate for eradicating maternal mortality deaths among Black women while raising her now. Her daughter is almost, or her daughter, granddaughter is almost 6. She's 5 years old now. She received a master's in public administration um, from Baruch um, CUNY College as a National Urban Fellow and an AD in English, American Studies from Dartmouth College, among the first class of women at Dartmouth. She was a 2010 graduate of Leadership, Maryland, and has served as an ombudsman to the Department of Defense ESGR office since 2013. Please join me in welcoming Wanda Irving.
Good morning, everyone. Thank you for that great introduction. Okay, let's get settled here. I'm really honored to be here before you this morning. And I know it's early, but can you indulge me for just a moment? If you're a health worker, a physician, or PhD, please stand. Scholars with MPHs, please stand. Any MPHs in the house? Okay. Any published authors? Okay. Businessmen, businesswomen? Devoted mother, loving daughter, or fiercely loyal friend? On your feet. Okay. Look around you. This is a very impressive group. One face that I would give anything in the world to see among you is my daughter's, Dr. Shalon Irving. She encapsulated all that this group represents. Thank you so much for standing. Shalon's colleagues referred to her as a brilliant researcher, a formidable equity champion, and a well-respected epidemiologist. In her work, she concentrated on issues of inequality and inequity across the lifespan, especially health outcomes for women and minorities. During her time as an epidemiologist at the CDC, Division of Violence Prevention, Shalon used her voice to fight for health equity by exposing hidden gaps that, I've left my glasses, but I have some readers. They're with you right now. Ah, this is so much better. Okay. Shalon used her voice to fight for health equity by exposing hidden gaps in public health. She intuitively saw structures, systems of relationships, and social dimensions of public health, problems that often went unnoticed by others. Yet her beautiful face is not among you today. Why is that? Because the very same health inequities she fought so hard to eradicate cost Shalon her life. And I need the clicker. Usually someone else is doing this, so it's taking me a little while to. Ready? Sure. I can't. It's not moving. I think I have the right one. I only see one clicker, so I think it's right. There we are.
Do you want
Thank you.
to do the slides for you?
Thank you. I'll just say next slide. I apologize. At 70 years old, technology still escapes me sometimes. But I'm trying. Okay. Next slide, please. I'm proud to be forever the mother of Dr. Shalon Irving. Shalon put a face to what decades of research has shown. Black women are not being seen, heard, or believed when it comes to their health, especially during and after pregnancy. I can confirm that until you've lived through the experience of losing a beloved daughter or a loved one to a preventable maternal death, you can't begin to fathom the gut-wrenching pain, the total devastation to families, and the lifelong trauma to the children left behind, which according to studies can be through up to 7 generations. Giving life should be joyful, not result in death. The loss of my amazing daughter ignited a burning desire in me to bring the hidden injustices of maternal mortality to light. The unrelenting pain of my loss fuels my commitment to change health outcomes for other Black women. I live with that commitment each day as I work to turn my pain into action. It was to turn it into purpose, but now I'm on a mission to turn it into action. Black women are among, next slide please. Black women are among the most marginalized groups in the United States. Let's talk for a moment about how that ranking factors into the health inequities that Black women face. The statistics show that between 700 to 900 women die each year in America. A great majority of them are Black. According to the statistics, Black women die at a rate of 3 to 5 times that of white women as a result of pregnancy or childbirth-related complications, giving the U.S. the deplorable distinction of having the highest rate of maternal mortality in the developed world. We know that maternal deaths are many of them are totally preventable. The CDC just this week, on my birthday, September 19th, released a new study. I was shocked, totally horrified. The percentage of preventable deaths had gone from an appalling 60% to an 80% rate in the past year. It's possible that number could have been 80% all along, and we didn't know it because we didn't have those figures from the Maternal Mortality Review Committee. Now that those are in place, they are saying 8 out of 10 deaths are preventable. 1 death is inexcusable, but 8? Common theory is that maternal deaths are primarily a result of the social determinants of health, which are factors such as your socioeconomic status and education level, as well as your access to health care. Social determinants do serve as barriers to quality health care for many women. However, even when you account for the social determinants of health, Black women like my daughter are still dying at an alarming rate. Why? Why do we continue to let this happen? I don't want to seem like I'm calling out physicians in the room, but I think you would agree with me that medical school teaches from a traditional biomedical framework. When it comes to racial health disparities, it teaches that Black people lag behind white people in virtually every health outcome, which is true. But instead of focusing on the root cause for why they lag behind, the disparities are often explained away by blaming the victim for being poor, for being uneducated, being obese, not taking care of themselves, not attending doctor visits, on and on and on. The blame continues to be on the victim. No focus is ever placed on the historical reasons behind those inequities. A large percentage of medical students have professors who perpetuate the same racial stereotypes they themselves learned when they were in medical school many decades ago. This vicious cycle allows upcoming physicians to be indoctrinated with those stereotypes and false beliefs about the so-called biological differences between white people and people of color. A framework for identifying and undoing racism in clinical practice is not taught, so the false beliefs and stereotypes continue to perpetuate health inequities. Next slide, please. Oh, I'm sorry, I'm a few slides behind, aren't I? Let's go to the next one, please. All right. Social determinants. Next slide, please. Okay. It's important to acknowledge that a medical education is shaped by he who defines the narrative, and that narrative has failed to teach how the impact of centuries of racism has intertwined to build barriers on a solid foundation of racist ideas and theories in medicine that continue to persist today. While higher education would seem as protective for women in terms of health, that's not the case for Black women. According to a report from the Commonwealth Foundation, a Black mother with a college education is at a 60% greater risk for maternal death than a white woman, get this, with less than a high school education. A recent study by the World Health Organization stated that 5 times as many Black mothers with college degrees die as white mothers with college education, meaning that for Black mothers, a higher education seems to only increase the chances of dying. Next slide, please. My daughter was a highly educated Black woman. She had a dual PhD in sociology and gerontology, which she earned in 4 years, summa cum laude. She became the first student at Purdue University to earn such a degree. She had a Master's of Science from Purdue and a Master of Public Health from Johns Hopkins. Both earned summa cum laude. She was a brilliant researcher, a certified health education specialist, a lieutenant commander in the U.S. Public Health Service, and a well-respected epidemiologist. But to me, she was my baby girl, my travel buddy, and my rock after losing both my sons and her brother. Next slide, please. Shalon and I were very close and did almost everything together. I love spending time with my daughter. By age 25, she had become my best friend. It did not matter if we were shopping, traveling across the pond, or just relaxing at our homes. And we always had this habit of watching shows together. So even though I'm in my house and she's in her house, we're on the phone. Did you see that? No, I missed that. I'm asleep. Mama's gone. I'm so sorry. But that's the way we were. We loved hanging out. We enjoyed each other's company. In fact, her friends used to always say that to them, we were the Black Gilmore Girls. So my daughter accomplished so much in her personal and professional life, but she longed for something that many women want, motherhood. Shalon struggled to become pregnant for many years and had gone through IVF and a lot of things because by 30, she says, you know, time's running out here. And she wanted a child. The men weren't coming, but she still wanted the child. So when she got pregnant at 35, we were overjoyed. We talked incessantly about the baby and names and clothes and future trips that we would take with the baby. In fact, we had a trip to Dubai planned and scheduled, and we were ready to go. At 2 weeks old, her baby had a passport. Bags were packed, just counting down the days till we were leaving. Unfortunately, we were not able to go to Dubai or collectively create any of the future Shalon envisioned for her child. Next slide, please. One more. Okay. Shortly after giving birth, Shalon's health began to decline. She complained of pain and discomfort to her physicians, but her concerns were quickly dismissed. She was giving condescending platitudes instead of care. Shalon visited her health physicians no fewer than 7 times in the last 2 weeks of her life. Each time, Shalon's concerns and symptoms continued to go unheard, unaddressed, and untreated because of the implicit bias of her healthcare providers, fueled by the systemic racism in healthcare. On January 24th, she went to her medical provider for the last time. She presented with swollen limbs, headache, severely elevated blood pressure, trouble voiding, and had gained 9 pounds in that past week. She pleaded with her medical providers to do something to help her, but still her concerns fell on deaf ears and were not addressed. She asked to speak with the high-risk doctor in the office, but was told that he was too busy to come in and see her. The nurse practitioner gave her a prescription for blood medication and instructions to come back in a few days if things don't improve. Once again, she was told to give it time. But just 5 hours later, time ran out. She suffered a cardiac arrest at home. Shalon was among the hundreds of women who died a needless, preventable death in 2017. Next slide. After Shalon's death, I knew that I never wanted anyone else to suffer the same loss and crippling grief I did and still do. I knew that I did not want my daughter's preventable death to be in vain. I knew that suffering in silence would be a betrayal of my love for my daughter. I vowed that her legacy would continue. In late 2019, Shalon's best friend and I co-founded and co-funded Dr. Shalon's Maternal Action Project, or DSMAP as we call the organization. We began operations in January 2020 on the anniversary of Shalon's death, with a working board of some of Shalon's friends and co-workers. Next slide, please. DSMAP contributes to maternal wellness both nationally and locally. Since inception, we have partnered with leading public health organizations, legislators, and community activist groups to advance our mission of combating maternal mortality rate. In fact, Congresswoman Lauren Underwood was a very, very good friend of Shalon's, and she started the Momnibus Act because of her friend Shalon. Our goal is to save the lives of Black mothers by increasing the public's awareness of the Black maternal health crisis and by developing and promoting evidence-based strategies that improve health outcomes for Black birthing people and families. Our work is based on the life philosophy, excuse me. Our work is based on the life philosophy of Dr. Shalon. I see inequity wherever it exists. I'm not afraid to call it by name and work hard to eliminate it. I vow to create a better earth. And she lived that motto every day of her life. She was never afraid to speak up when she encountered racism. We at DSMAP have taken Shalon's vow and committed to shifting the ever-climbing rate of maternal mortality into a downward trend. Next slide, please. Our work is grounded in 4 pillars: storytelling, empowerment, community building, and education. These 4 pillars is to connect, collaborate, and co-create healthier outcomes for Black women by removing barriers, addressing biases, and disparate practices that impede access to equitable, respectful care. DSMAP uses storytelling as a behavioral change and empathy as a driver so that Black lives are valued and Black mothers are heard, listened to, and believed. Since Shalon's death, I have done numerous interviews, speeches like this, and presentations all over the country to spread awareness of the maternal mortality crisis through Shalon's story. At DSMAP, we believe that promoting patient empowerment and engagement leads to community building through the creation of community supports and safety nets for Black birthing people. Educational information shared through our digital platforms serves to build strong community networks. One of the most common complaints I hear from Black women accessing health care is that they are not heard. And it's not that the practitioner doesn't physically hear the words they're speaking, it's that they don't necessarily understand the cultural content from which they are spoken. So a lot gets lost in the translation. Through community building and in collaboration with our partners, we provide anti-racist training and cultural competency training so that practitioners are better able to hear and understand every patient. We have also aligned with organizations who are increasing the pipeline of Black and brown people into the medical field, along with creating culturally competent medical providers in traditional as well as non-traditional fields, such as doulas, midwives, and community birth workers. We are connecting, collaborating, and co-creating a new reality. Next slide, please. Now I'd like to share with you a little about how DSMAP is leveraging technology to improve health outcomes for Black women. One of the first steps we see toward reducing the Black maternal health crisis is for clinicians to treat every woman with respectful care, regardless of her hue. Listen to her and believe her. Our Believe Her technology solution is an anonymous, evidence-based model which offers a connection to an affinity community of mothers to help improve health outcomes for Black birthing people and families. The Believe Her app is designed by and for Black women to fill a gap in the healthcare system, but it does not replace the role of the healthcare professional or offer medical advice. Instead, we offer a community-based model built on peer-to-peer strategies. Our Believe Her ambassadors facilitate conversations and direct mothers to resources that enhance, supplement, and expand the work of healthcare workers by providing necessary social and emotional support. The Believe Her platform brings together mothers, birthing people, midwives, and doulas to share their experiences on the birth journey from pregnancy to parenthood, and also provides a library of vetted healthcare resources. In addition to the quantitative value of real-life stories, the Believe Her app incorporates quantitative measures as well. We would love to get the app in the hands of every pregnant or postpartum mom across the country. I implore health plan representatives here today to consider offering Believe Her as a value-added benefit of your health plans. Hospitals, imagine what a great resource the app would be as part of the discharge package for every mother. Next slide. One more. I'm excited to say, go back one, I'm sorry. I'm excited to say we are currently working to enhance our Believe Believe Her app. New enhancements will include a digital learning community that will offer empowerment training for Black birthing people on such topics as how to speak so your doctor will listen. Our ambassadors will provide live streaming sessions on Instagram and Facebook. We have partnered with a cadre of doulas, prenatal to postpartum, to offer a doula helpline. Doulas will hold regular office hours on our app and be available to women as a resource through our website, as well as video chatting on our app. The Believe Her app is designed to help the highest risk mothers and birthing people. We connect them to DSMAP's community of experts and providers, provide scripts for high-frequency interactions with clinicians, referrals to local advocates, maternity care, and birth equity workers, and ideally, live chats and video conferencing so that the underserved and uninsured can quickly have access to healthcare peer support. Next slide, please. DSMAP recently launched our new Black Mom Uncensored podcast that focuses on awareness and tells stories about Black maternal health, mortality, morbidity, and equity. A few of the most important or popular episode topics have included ones with fathers, the men who are left behind. We think it's important to get their view as well. We've talked about the afterbirth and the healing, the home births, and surviving postpartum. And I encourage you to take some time to listen and follow our podcasts. Season 1 is on Spotify, and we are gearing up for Season 2, which will begin in October. We invite you to join us weekly as we use storytelling and revealing conversations to examine different aspects of the pregnancy journey and share the realities of the maternal health crisis for Black birthing people. Our goal is that this podcast will not only provide education and the tools to advocate for equity, but also shed a public light on the realities. Next slide, please. Middle and high-income Black parents above 35 with private insurance often have less access to pregnancy and postpartum support information than parents who live and use WIC and other programs. In many contexts, broadly available supports for services are advertised directly through assistance programs, and social workers have helped promote, these are not working either. And social workers help provide coordination of care and services. In contrast, privately insured parents also have to maneuver healthcare and support systems alone sometimes, and often don't know what services are available to them or where to look or how to ask to get help. So our new digital initiative, Knowledge is Power, we call KIP, will debut in the spring of 2023. KIP is a twofold initiative. The goal is to reduce systemic health inequities by targeting high-risk geriatric Black mothers over 35, which my daughter was. Excuse me? we teased about it all the time, your geriatric pregnancy. So, and that's what they are referred to if you're over 35 and pregnant. It is now considered geriatric. I know. As a multi-pronged collaborative effort with our academic and doula partners, KIP will support efforts to advance a birth justice agenda geared to surviving the pregnancy journey, most specifically the postpartum period. Next slide, please. I'd like to share with you also an exciting new technology development that's in the works. We just finished part 1 of it, and we're gearing up for part 2. DSMAP recently participated in the Microsoft Global Hackathon. I don't know how many of you heard that, but it's an absolutely wonderful program. while teams are usually 10 to 15 people working on hackathon ideas with Microsoft, over 44 Microsoft employees teamed up with us across 3 work streams: research, app development, and marketing, to help us prototype a brand new app. The app development team took all the insights, ideas, and input from user research and subject matter experts to design out an interactive front-end prototype. We are so excited, and we will be piloting that new app in early 2023. And it's designed to absolutely revolutionize the peer support technology field. Technology is truly a wonderful thing. Technology has the power to build, inform, and engage digital communities so that they can connect, collaborate, and co-create solutions to the social problems we are all facing. I've shared with you how DSMAP is leveraging the power of technology to improve birth outcomes for Black birthing people. I invite you to come and connect with us, to collaborate, so that we can co-create a new reality in healthcare. But we know that inequities will not be solved by technology alone. Next slide. I would like to spend my last few minutes before you offering a few action steps for addressing the maternal mortality crisis in America. You can feel free to contact me at any time if you want to connect, collaborate on ways we can co-create better health outcomes. It's imperative that we all collectively prioritize health care for Black women, and we all make the commitment to taking meaningful action. It's not going to happen by one person or one organization alone. It's going to take all of us to move that needle. Many Black women have a difficult time accessing reproductive care that meets their needs. Access to reproductive health care, which helps women plan their families, improve health inequity, and improve health outcomes for women and children. Only 87% of Black women of reproductive age have health insurance, and many more experience gaps in coverage during their lives. To improve Black women's health outcomes, policies must start focusing on expanding Medicaid and maintaining access to care and coverage for all Black birthing people. Healthcare providers must stop blaming the victim and start showing more compassion to Black women by respecting their voice and granting them the autonomy to make decisions regarding their body. Adopt the Shalon method as a first step, and you'll see it there. Shalon, she's somebody's mom, daughter, spouse, or partner. Show her the respectful care she is entitled to. Hear what she says. Acknowledge and accept that she knows her body better than you ever will. Listen to her and believe her. Observe and monitor any changes in health conditions and take appropriate action. That's where they failed my daughter. And never, never, ever forget your oath to do no harm. I also feel that more Black women need access to traditional but non-traditional methods as well. We want access to healthcare providers who are capable of providing unbiased care and addressing obstetric emergencies. We need doulas, we need midwives, we need non-traditional methods that work for our community, for our people. Combating maternal mortality in healthcare starts with every state taking steps to ensure safe maternal care for Black women exists. Next slide, please. We all know that multiple factors contribute to health disparities, but many fail to understand and acknowledge that structural racism and implicit bias play a critical role in the variation of quality health care. We need to address systemic racism, not hide from it, not ignore it, not give it tacit approval. We must all work together to transform the healthcare system. Healthcare professionals must explicitly acknowledge that race and racism do factor into how they provide healthcare. I ask everyone within the sound of my voice to commit to taking the responsibility of dismantling the current system and rebuilding a more equitable system. It's within our power. Less directed efforts to improve health outcomes may lead to worse outcomes for Blacks and will not lead to equal gains across groups. Policymakers should implement processes to improve maternal health data collection. Data should provide a foundation that helps others to comprehend the impact of maternal health care inequality among Black women. We have to start creating a system that holds healthcare facilities accountable when they allow structural racism to take the lives of Black women, like my daughter. Next slide. The maternal health crisis in America is not new. It's not something that just came upon us. It's been occurring for decades. Women are dying, good women, women who are loved, women who are needed by their families, women who bring tremendous value to society. Children are being left to face the challenges of growing up in perilous times without their mother's love to guide them. There's not a day that goes by that my granddaughter doesn't talk about how much she misses her mom. Now, her mom died when she was 3 weeks old, but she misses that love. She knows there's something missing in her life. And she talks about her mom as if she were there. And it's like, well, and she asks me questions. Nona, what would mommy do about this? What would mommy do about that? And she can tell you the answer. She knows her mother's story because I've told her. And now she plans to be a doctor so that it doesn't happen to women on her watch. And I'm so proud of her for the way she deals with this every day. And I know it's something that's eating at her. And like I said earlier, the studies show that childhood trauma follows these children. And it's evident in generation after generation. And it's funny because when I was looking up a few years ago, trying to get some information on childhood trauma, I came across my daughter's dissertation. And I didn't realize that that's what she had talked about in this dissertation. And it's a published dissertation on Sticks and Stones, I think is the title, and childhood trauma. And it has sort of like a playbook on what happens and how these kids carry that trauma to their families and how their children carry it to their families. So it's not something that goes away. At DSMAP, we continue to grow and expand, looking for new partners and collaborations in this very, very difficult birth justice work. Next slide, please. Oh, no. Connect with us, collaborate with us. Together we can co-create a new reality where Black women survive and thrive during and after pregnancy. As I close, I'd like to share a short clip of a video interview that summarizes what I've shared with you today. Thank you for being such an amazing audience. Shalon was such a fierce equity warrior. And she had her motto, I see inequity wherever it exists. I'm not afraid to call it by name.
to eliminate it. I vow to create a better earth. And so that to me is important to make sure her daughter understands who she was, what she stood for.